In this last portion of today's lecture on the integument, we're going to talk about a couple of disease conditions of the integument, including various skin cancers, as well as burns. And we'll finish up today saying just a few things about tattooing. But let's begin with skin cancers. All cancers begin with a mutation in the DNA molecule. So the cause of skin cancer is a mutation somewhere in the DNA. The mutation is a specific type in that it contributes to a loss of regulation of cell division. Normally, the process of cell division is very tightly regulated. In other words, the body spends a lot of time and energy preventing cells from dividing in an uncontrolled manner. When that regulation is lost, cells begin to divide in an unregulated, unnatural way. And that's what cancer is, particularly when those abnormally dividing cells spread throughout the body in a process known as metastasis. So at the base of every cancer is mutation. Now, all mutation is a change in the order of the bases in the DNA molecule. When it comes to cancers of the skin or cancers of the integument, there are three primary types. There's what's called a basal cell carcinoma, a squamous cell carcinoma, and a melanoma. Now, this word carcinoma is important. About 90% of cancers are of the carcinoma type, and that term tells us that the cancer arose from epithelial cells. Remember, epithelial cells line the surface of the body, the integument, and they also line cavities in the body, as well as the internal parts of glands. So it makes sense that epithelial cells are the type of cells that are mutated most often, because they are exposed to environmental conditions more than any other cell in the body. The basal cell carcinoma is the most common type of skin cancer in human beings, and luckily, the least dangerous type. Like the name suggests, basal cell carcinomas come from epithelial cells in the stratum basale. So those stem cells that are sitting in that lower, bottommost layer of the epidermis. Squamous cell carcinomas are different. Squamous cell carcinomas arise from epithelial cells in the stratum spinosum. And squamous cell carcinoma can metastasize, although if it's caught early enough, it can be removed before metastasis occurs. The third kind of skin cancer is the melanoma, and of course that's the most deadly type. Melanoma very commonly metastasizes or spreads throughout the body, sometimes even before it's detected. Melanoma arises from melanocytes that are inside the stratum basale. Now, one thing that we need to be familiar with regards to melanoma is what's referred to as the ABCs or ABCDs of melanoma. This is a little mnemonic device or a memory device to remember some features of melanoma that are really important. The A stands for asymmetry, the B for border, and then we have color and diameter, and sometimes people add on this word evolving or E. So melanomas tend to be asymmetrical skin tumors. In other words, unlike some other growths that you will find on your skin, melanomas tend to be asymmetrical or have a very odd shape. The border around a melanoma tends to be very irregular looking. The color of a melanoma tends to be very strange, sometimes containing multiple colors in the same growth. The diameter of a melanoma tends to be larger than the eraser on the end of a pencil. And this term evolving reminds us that most melanoma tumors tend to change right before our eyes. In fact, what often brings people in to the doctor to have a growth on their skin checked is because that growth has changed somehow. Maybe it's changed color, or maybe it's gotten bigger, maybe it's started to itch. Something has changed, something has evolved that has brought it to the person's attention. On this slide, we're looking at some images of these three skin tumors. Up at the top left, this is a representative basal cell carcinoma. I think you'll agree that this growth on the skin has nice even borders and it's quite symmetrical. It also has a real distinctive color to it, sort of a reddish pink color. You would be forgiven if you looked at this and didn't think anything of it. It doesn't look like anything particularly bad or dangerous. But if you were to take this off and look at the cells under the microscope, you would see that these were cancer cells. This is basal cell carcinoma. This is the most common skin cancer and luckily the least dangerous. Over on the right-hand side, this is a squamous cell carcinoma. And I think right away you can see it looks different from the basal cell. However, only looking at this under the microscope will tell you for sure that it's a squamous cell carcinoma. Now, squamous cell carcinomas tend to have this scabbing feature. They tend to get more irritated on the surface and therefore scab over, or get maybe what can be described as a crusty appearance. But again, you would have to look at this under the microscope to know for sure that you had a squamous cell carcinoma. Down at the bottom, you can see a range of images of melanoma. I had a professor tell me once in veterinary school that the only sure thing about a melanoma is that you can't be sure of anything. They all look a little bit different. Now, the one feature that you can see through all of them is that they have a deep color, a dark color, and that's very typical of melanoma. Although I think you'll agree that the color really varies from tumor to tumor here. So again, people are told these A, B, C, D, E's, the asymmetry, the border, the color, the diameter, and the evolving nature of this kind of skin cancer. This is the most serious type of skin cancer because it tends to metastasize and it can kill you like other metastatic cancers. I want to take just a minute and talk about this role of ultraviolet light in the development of skin cancers. Remember, all cancers begin with a mutation in the DNA of one cell. All tumors begin with one abnormal cell, and that cell has its DNA mutated in a way that allows it to grow, to divide in an uncontrolled manner. Now, there are lots of things that can mutate DNA. Ultraviolet radiation is only one of them. But because the skin is exposed to so much ultraviolet radiation, It's exposed every time we go out into the sun. It plays an important role in the development of skin cancer. Now, the one piece of good news about ultraviolet light is that it doesn't penetrate very far. It's only capable of penetrating about 2 millimeters down into the surface of the skin. But of course, that's the whole depth of the integument. So part of what the skin does for the human body is sort of sacrifice itself, if you will, to the effects of ultraviolet radiation. If the skin wasn't there, the deeper tissue would get exposed to the ultraviolet radiation and would suffer the effects. Now, what exactly does ultraviolet radiation do? Ultraviolet exposure actually damages DNA, but doesn't mutate it outright. Remember, there are 4 bases in the DNA molecule: adenine, thymine, guanine, and cytosine, or what we often refer to as A, T, G, and C. It's the T in DNA, it's the thymine in DNA that gets damaged by ultraviolet exposure. The ultraviolet radiation causes what are called thymine-thymine dimers to occur. Any place where there are 2 thymine bases side by side in the DNA molecule get damaged. They get joined together with a bridge structure called creating what's called a dimer. Now, this thymine to thymine dimer, this DNA damage, becomes a problem when that cell divides. The enzyme that comes along to perform DNA replication is not going to know what to do when it bumps into that thymine-thymine dimer. It's not going to know how to build new DNA in that area, and so it often places the wrong bases in that area. Again, this happens when that cell prepares to divide. The damage, the thymine-thymine dimer damage, interferes with the normal process that replicates DNA, and that leads to mutations. All a mutation is a change in the order of the bases in the DNA molecule. But if a mutation removes a cell from the normal controls around cell division, that mutation can become a cancer. It's also important to know that ultraviolet radiation exposure can kill cells if they are too badly exposed. So sometimes it just damages the DNA, but sometimes it kills the epithelial cell outright. And this is what we refer to as a sunburn. This kind of damage to cells causes the outer layer of the skin to flake off. You've probably experienced that as peeling skin when you get a sunburn. Ultraviolet exposure over the long term also just contributes to the aging of the skin over time. Now, it's interesting to note that the risk of developing any of these adverse effects of ultraviolet radiation exposure are much more significant in people with lighter colored skin. Remember, melanin can absorb ultraviolet radiation and protect the DNA from being damaged. Melanin is protective. So anyone who has lots and lots of melanin in their skin has less risk of developing skin cancers. Now we're going to turn our attention to the phenomenon of burns. You could argue that burns are one of the most significant medical issues that happens with the skin. There are lots and lots of ways that the integument can become burned. Now, the most obvious is the thermal burn, or the application of too high a temperature to the integument, to the skin. It's also possible, though, for the skin to become burned when it's exposed to different chemicals. It's possible for burns to come about through radiation exposure. It's possible to become burned through electricity. And of course, as I said a minute ago, it's possible to become burned through ultraviolet light. When we look at burns on the skin, we classify them into degrees. I have the three most commonly used degree classifications on this slide. A first degree burn is the least serious type of burn. This is what we refer to as a partial thickness burn because it doesn't extend all the way through the integument. It only goes down into the epidermis. First degree burns produce a redness to the skin, some swelling, some heat, and some pain. If those terms sound familiar to you, it's because those are the terms associated with inflammation, and a first degree burn will set off an inflammatory response. The good news is that first degree burns tend to heal without any scarring or any problems, although they're pretty uncomfortable to have to live through. Second degree burns are also partial thickness burns, but they're more severe because these burns go through the epidermis and into the dermis. Second degree burns are visually distinct from first degree burns because in addition to the redness and the swelling, we see blistering of the skin. Second degree burns can heal with or without scarring. It depends on how severe the burn is. And finally, there are third degree burns. Third degree burns are full thickness burns. They go all the way through the integument, through the epidermis, through the dermis, and into some portion of the subcutaneous tissue. So in a third degree burn, the integument is lost, at least in the area of the burn. And as we said earlier, because the integument is critical in controlling the balance of water in the body, anytime a third degree burn happens, that area is going to experience a rapid dehydration. Because the skin is removed in the area of a third degree burn, there's also an increased risk of infection as long as that burn is exposed to the world. Third degree burns don't tend to heal, they tend to scar. And depending on the extent of a third degree burn, you can have a complete loss of regeneration in that area. In other words, all of those accessory structures in that area are gone. The hair follicles will be gone. Sometimes the blood vessels will be gone and unable to regenerate, and a scar will be left behind. So third degree burns often require skin grafting. Now, some source materials will also describe a fourth degree burn and a sixth degree burn. I'm only going to hold you responsible for these three. But just in case you read a source that describes a fourth degree burn, that is the kind of burn that would not only go all the way through the integument, but it would go all the way through the subcutaneous tissue into muscle and even bone. Fourth degree burns would therefore be all the more serious than a third degree burn. And finally, some source materials describe a sixth degree burn. That is a burn that not only goes all the way down to the muscle and bone, but actually completely destroys an area, creating charring and a complete loss of function. So not only is there scarring and a loss of structure, but there's a functional loss to the region that experiences that level of burn. One of the things that is critical to the management of burns is being able to estimate how much of the surface area of the integument has been lost. Remember, the most important thing that a burn does is it removes the control of water balance. And if too much of the surface area of the body is affected, the person can very rapidly dehydrate and die. So the very first concern in managing significant burning is fluid replacement. And in order for the physician to calculate how much fluid needs to be put back into the bloodstream, they need to have an understanding of the relative percentage of the integument that has been lost. So physicians use what's referred to as the rule of nines to make that kind of an estimate. And that term, rule of nines, came about because it turns out that different regions of the human body represent some multiple of 9% of the surface area of the skin. I have a list here of how the different regions of the body come into an estimation of how much of the body gets burned. For example, if a person experiences a third-degree burn over both the anterior and the posterior portions of their head and neck, that is a burn that covers 9% of their body. 9% of the total surface area of the integument. Each of the upper limbs is also about 9% of the surface area. So if a person were to get a third-degree burn, say, on the head and neck and both of their arms, that would be a total of 27% of their integument surface area. Each of the lower limbs, along with the gluteal region for the limb, represent 18%, because of course your legs and your backside represent a greater proportion of the surface area on your body. The anterior surface of the trunk is 18%. The posterior surface of the trunk is 18%. Interestingly enough, the perineal area, and of course that's the region that stretches between the rectum and the anus forward to the genitalia, that's about 1%. So all of this together, depending on where an individual gets burned, gets added up so that the physician can then calculate the total percentage of surface area of integument involved and how much fluid that person is going to need to receive to replace the losses where the integument is gone. It's important to remember that burns are a medical emergency. Obviously, a first-degree burn is not something that needs medical attention. Second-degree burns may or may not need medical attention. It depends on the extent of the body that's been burned. Third-degree burns, of course, are very serious and require immediate medical attention. Fluid loss is the greatest danger. Infection is the next greatest danger. When you listen to physicians who treat burn patients, because burn medicine is a specialized area of medicine, when you talk to physicians who work in that area, one of the things that is most fascinating is the fact that people who receive third-degree burns over large portions of their body are often not in much pain. And the reason, of course, that they're not in pain is because they have lost the entirety of the integument. So they've lost all those sensory neurons, those sensory nerve endings that used to be there to perceive things like pain. Now, burns get classified as critical, as life-threatening, when more than 25% of the body is covered with a second-degree burn, or 10% of the body is covered with a third-degree burn. Another classification is that any third-degree burn that involves hands, feet, face, and perineum is considered critical. We're going to lighten things up now for the last portion of the lecture and just say a few things about tattooing. Tattooing has become very, very popular in our culture, and it's a good example of the anatomy of the integument when we think about why a tattoo is a permanent mark on the skin. Tattooing involves an injection of dye not into the epidermis, but into the dermis of the integument. And the reason it's permanent is because the dermis is made out of connective tissue. The epidermis is made out of epithelial tissue, and as we know, epithelial tissue is highly regenerative. It turns over. So if you were to inject dye into the epidermis, the tattoo would not last. But because the dye is injected down into the dermis, into connective tissue, it lasts. So that dye that's being injected with tattoo needles is actually being deposited as little blobs or little granules down into the dermal tissue. Now remember, there are immune cells in the dermal tissue. There are what we called dendritic cells in that layer, and part of their job is to get rid of foreign material. The reason that the immune system can't get rid of a tattoo is because those dye granules are just too big. Those cells aren't able to engulf those big blobs of dye, and so the dye persists. Now, if you look under a microscope into the dermis of a person who's had a tattoo for a long period of time, one of the interesting things is that the body will produce a scar around the dye granule over time. The body, in other words, basically tries to wall it off because it is a foreign material and it doesn't belong there. Now, along with the increased prevalence of tattooing in our culture, there's also been an increase in the desire to have tattoos removed. And there are different methods for getting rid of a tattoo. Not all of them are good. One of the oldest methods is surgical excision. In other words, if the tattoo is in a small enough area of the integument, you can have that piece of skin simply cut out and the edges brought together. Surgical excision, though, particularly since it's going to involve all the way down through the dermis, is going to create a scar where the tattoo used to be. One of the newer methods is what's called dermabrasion, and like the name suggests, this is a process that literally abrades away the skin in the area of the tattoo. I've never had this done, and I don't know anyone who has, but I'm told that dermabrasion is very painful because they are literally abrading away or traumatically removing that area. The most recent development in tattoo removal is laser tattoo removal. This has been the most promising. This is also the most expensive way to have a tattoo removed because it takes several applications. But what happens is the physician applies a laser to the tattoo, and the light of the laser actually penetrates into the dermis and helps break down those dye granules. And once they become small enough, the dendritic cells, the immune cells in the dermis, can surround them and get rid of them. On this slide, you're looking at a person having a tattoo removed through laser application. This is the original tattoo on the upper left, And then what you're looking at is what that tattoo looked like after the first treatment and the second treatment and however many treatments later. I think you'll agree it looks really good. You can't see the tattoo in the end. You also don't have any scarring, which is very nice.